Okay, so what I wanted to share with you this morning is an experience of one of my patients that I've taken care of for some time, and Ross has been kind enough to come and out of his day of probably golf and give a little testimony relative to an experience that he had, we both had. So Ross Bridgman has been my patient for about 3 years or so. I took care of his mom for many years, and his situation is that he developed an early wet AMD, and he's a pretty compulsive guy, and he knew something was wrong. He had mom as somebody that he knew about macular degeneration, so he came in very early. He had some OCT changes, and to make a long story short, he responded favorably to Avastin injections. Over the 3 years, we've really been, it's been difficult to wean him off for any length of time. We try to stretch it out, and he'd flare up. So he's almost now as a maintenance every 6 to 8 weeks, and he's done very nicely until May of this year, which I want Ross maybe to explain to you what he experienced. I thought it'd be interesting. So Ross, you've had this, many shots. So tell us what went on in May that was different than before.
Okay, well, the beginning of the experience was fairly typical. We came in, had the procedure done, nothing unusual about it. When I left the office, my vision was no more impaired than it usually is after an injection. I went home, I actually went out to play golf. Everything was fine. That evening,
I know he went to play golf because he was saying, I'm going to pick up some new golf clubs. So he was excited about using the new golf clubs.
So in any event, we're fine that evening, and I go to bed with nothing remarkable, and I take the little steroid drops for the inflammation in my eyes. So early in the morning, I'm an early riser, it's dark. I go to the refrigerator, I open the refrigerator, and for heaven's sakes, I can't see the creamers. All I have is what I would call a sleet storm of soot. I mean, it's raining soot, and to say that I was alarmed would be to flatter alarmed. So it was too early to call the doctor's office. But I did call pretty early in the morning, about 8 o'clock in the morning. And I talked with Dr. David Dorff, who immediately set me up with Dr. Allen. I think by 10 o'clock in the morning, I was at Dr. Allen's office over in the main Havner Eye Clinic over on Olentangy River Road. Dr. Allen, great guy, very promptly injected me with a steroid and an antibacteria, and was, fairly reassuring that one or the other of these things would begin to take hold. Friday was not a very good day for me. I was fairly anxious most of the day. There was no discernible really improvement in the eye on Saturday. So, but plans had been made for me to come in on Saturday. Dr. Allen saw me on a Friday. Dr. Shaw saw me at the clinic on Saturday morning. Dr. Shaw, likewise, very competent, solicitous, nice person, reassured me again, examined my eyes. Dr. David Dorff, I think, was in constant contact because they would talk to him, and then talk to me, and then go back to talk with Dr. David Dorff. So everybody was working really very hard. And by Saturday morning, things began to improve somewhat. Still had a lot of black rain. It's kind of hard to describe the sensation, but that's as good as I can do. So the decision was made on Saturday that because we wanted to see what the heck was going on, it seemed to be a little bit better, but we're still very concerned about that I might relapse or go backwards. There was a decision to be made that I would be seen by Dr. Shaw on Sunday. I was. Again, things were much better on Sunday, but there was a thought that we ought to have a final follow-up on Monday, and I did. I came out to Dublin, to the office, to see Dr. Allen, in fact, so now, at that point, things had calmed down quite a bit. I still, from then to now, I still have floaters. They're different than the typical floaters that I've had. They're still like the soot. They're kind of black spots that float in the eyes. And I was just telling Dr. David Dorff, they remind you a great deal of flocks of birds or insects or whatever. And they're aggravating, but I can read, and they're not impairing my vision. They are preventing me from spotting the golf ball in the air, which is a little bit disconcerting, but
That's the new,
I can
the
live
new
with
clubs.
it. I can live.
New
I can
clubs
live
are
with
getting
it.
so far.
I did, Dr. David Dorff is alluding to the fact that on Saturday, I was to be fitted for new clubs, and I went out to try to hit the ball with new clubs and couldn't see the ball more than 10 feet off the tee, so I did not buy the new golf clubs on Saturday. So that was kind of what happened, and so I'm very grateful that we're sitting here talking about it today, and it seemed to be an event of the past.
Yeah. So this is a scary thing for the patient, big time. It's a scary thing for the doctor also, and it kind of fits in with the syndrome that we're talking about, and we'll talk about after this. So I mean, that really presents from the patient side what this looked like. I think the fact that it got better so quickly, is not something that happens with bacterial infections. So what I didn't add is early that Ross is an attorney. He's a recently retired attorney. He was the head of healthcare for Voorhees and did a lot of work for the university. So what we all worry about in the audience and myself is that one of these days a patient's going to sue us, and so Ross has a unique perspective from the attorney side. Is what, Ross, can you tell the audience about how to avoid that, and some of the things maybe that should be done and were done? Address that, if you will.
Well, first of all, what I'm going to tell your audience is not in the nature of a legal opinion about any particular case. So I will tell you what my view of how this was handled was for me personally, informed by the fact that I am very well aware of the risks inherent in the practice of medicine, and that risk is something that is really on the mind of doctors. But in my judgment, what happened with me, Dr. David Dorff, Dr. Shaw, Dr. Allen, was exactly the way these kinds of matters should be handled. First of all, there was no pussyfooting around. There was something wrong, and it was terribly wrong, and we needed to address it promptly. There was no clamming up. There was no, I can't talk to you about this. I need to go talk to my lawyer first, and all that kind of stuff. There was simply a very prompt addressing of the situation, a very candid conversation with the physicians. We don't know what's going on. We're still trying to figure it out. This is new in our experiences, or it's very rare in our experience. We don't know what happened. It could have been the temperature of the product. It could have been this. It could have been that. And we're looking at it, and we're examining it. But first things first, we need to get you better. That to me was very reassuring, and it puts the physicians on my side as opposed to in an adversarial kind of relationship. I think that's in most cases. There are obviously going to be exceptions to that, and I'm not telling anybody not to be guided by their own counsel. What I'm saying is that for me, knowing what I know, I want candor, and I want upfront, and I want to be told. If there's gonna be a lawsuit down the line. That's the least of people's problems right in the middle of the crisis. In the middle of the crisis, it needs to be dealt with. And if you deal with it, your patient, me, is not gonna be a predisposed plaintiff. I'm not going to be looking to file. I'm going to be doing the other thing. I'm going to be saying, okay, everything has been done that can be done. That isn't to say it's going to work in every case. That isn't to say that there aren't people looking to file lawsuits. All that stuff is true. What you need to do, though, is remember that that is not true of the vast majority of your folks. You can make them mad. You can make them into plaintiffs if you want to. But if I were counseling you, I would be saying, well, let's not do that. Let's see if we can't work through these things. Be on the side of the patient. Be nice. Be compassionate. Be likable. All the things that Dr. David Orff, Dr. Allen, and Dr. Shaw have been, and you're going to minimize your issues.
Well, okay, that's, you heard it from the, quote, horse's mouth,
Or something.
A guy that had something, obviously related to the injection. To say it wasn't related to injection wouldn't be forthright. And I thought it also, because I appreciate Ross's comments about, the litigation side of things too. So very helpful, Ross. Thank you for coming. And
My pleasure. Thank you.
This morning.
Thank
Okay.
you.
Okay, great.